We're going to be talking about the lipidology, the antiplatelets and anticoagulation, and of course the advances in revascularization techniques and how the coronary patient start feeling safe in this area. So we now know that metabolic syndrome, where you expect truncal obesity, sort of laziness in the body, yawning attitude, and it sort of leads to lots of diabetes, fivefold, 2 times more cardiovascular diseases, strokes also 2 to 4 times more, myocardial infarction 3 to 4-fold more, and of course an early mortality. So when you are at metabolic syndrome level, that's the level where you should start taking aggressive preventive care. And this aggressive preventive care is going to be addressed in some of the topic, these slides, which we are going to discuss later. So there is a 30 to 40% probability of developing diabetes and cardiovascular disease within 20 years, depending on the number of components you have. Now, this is actually a follow-up study of so-called healthy nurses and health professionals. And on this side, you have HbA1c moving from 5.5 to 6 to 6.5. And on this side, you have a CRP levels. And as you know, more than 2 CRP is abnormal. So from normal to abnormal. So when you have these A1C going high and CRP going high, both together, when both are high, you probably have the highest event rate from cardiovascular angle. So both these factors, not routinely discussed in clinical practice, are important and can play a very important role later. So let's talk of lipids, and along with lipids comes statin.
I have Dr. Monish Raut from Delhi asking about intravenous antiplatelet agents such as cangrelor. If you could throw some light on that.
Mm-hmm. Actually, as I said, we did some very important trials, and cangrelor was used in early ACS, and we contributed 100 cases, which was almost 1/10 of the size of the trial. So this is a very rapid-acting antiplatelet agents, not available for commercial use in India. We used it as a part of drug trial a few years earlier. The good part is when you are doing a case, the action is very steep. You give a bolus, and within few seconds, the antiplatelet action is on. So you get a very effective action. So whenever you have an emergency case, this becomes very, very important. The good part also is, like, if you run into some kind of complication, you just switch off the cangrelor, the antiplatelet action comes down quickly. Like you have a vessel perforation, you want the bleeding to stop quickly, you just switch it off and the bleeding will probably stop. So we are waiting for this kind of molecule to hit the Indian shores, which may not be too far away. But I'm surprised that it takes taking so long, though it was approved in US. In US, cangrelor is used almost in 80% of the cath lab, while we don't have it.